The buccal fat pad removal is one of the commonest procedure what the youngsters asking for nowadays because they all like the sunken look. But understand this something called trend and the real. The trends will come and go. Say example, the pouty lip is a very popular thing the earlier days. Now it has gone. So when you're doing something for the trend, try to do something reversible. The sunken cheek, what the buccal fat pad removal, what you're asking for is an irreversible one. What we do, we give a local anesthesia, and through the inside cut, we go and remove the buccal fat pad, not completely, minimally. So why minimally? The fat is very important structure to delay your aging process, because what happens when you're aging, the fat in the face tends to shrunk in size, and same way the facial bone tends to reabsorb. So because of these two things, your skin started sagging, so you look older. So when you do the buccal fat pad removal, what happens? You're in the younger age. When the age advances, you look older even at 30s and 40s. So unnecessary and overdoing of the buccal fat removal is not correct. And more than that, the area where we are removing the buccal fat had a lot of important structures like a salivary gland ducts as well as the facial nerve branches. If the doctor is not trained well doing this, you might end up in a complications. And same way, asymmetry will be the norm because 100% symmetrically removing is extremely difficult. Mild asymmetry is the norm. So don't overdo the buccal fat removal. Ask your plastic surgeon whether it is really necessary to reduce the facial size or any other options for you. Sometimes not only the buccal fat, the muscle behind that will be a problem for your bigger face. So understand your problem correctly. If the plastic surgeon and you both will agree to the point that okay, buccal fat removal will be useful for you, so the plastic surgeon will reduce the buccal fat instead of removing completely and gives a natural looking face, same time a smaller looking face. So don't overdo the buccal fat pad removal. The fat is very important to prevent your facial aging. Understand this. What is Masseter Botox injection? Why you need to go for it? Somebody feel that face is very big. Sometimes we need to do a little buccal fat pad removal to reduce the facial size, or sometimes their muscle in this region become bigger. This is called the masseter muscle. When you tightly clench your teeth, like that, we can feel the muscle here. It will be like a solid hard bone like a thing. So when the muscle is so bulky, that time the face looks bigger. So in that case, you will be benefited with the Botox injections. A lot of confusion happens if I do a Masseter Botox injection whether I look more aged. There is a theoretical possibility because when you reduce the muscle bulk here, the skin becomes little loose so that the jewel becomes little more. So the sagginess here will be shown more. Yes, it might happen if your skin quality is bad. So consult your plastic surgeon before going for a Masseter Botox injection, whether it will be really useful for you or not. Another thing, sometimes if it is given wrongly, your smile looks little different. Though it is short-lived, sometimes when you come a little closer to this side, the muscles involved for the smiling might get affected. So because of that, little bit smile changes will be there. Be aware of those things. So the same way, Masseter Botox, if you keep doing continuously every fourth month, it becomes almost permanent. So the requirement of the drugs will goes down a lot and gives a good results. So Masseter Botox is one of the good thing to reduce your facial size. Sometimes along with the Masseter Botox, we need to do the buccal fat pad removal in a limited quantity so that your aging signs won't get aggravated. These are the things you need to understand. Sometimes people come and ask, Doctor, my face is very small, it's sunken cheeks, I don't have any fat in the face, what will I do? See, a lot of times what happens, the people who wanting to have fat in the face, they don't have fat anywhere in the body also. That's the problem sometimes. Because when we want to do the fat transfer, because we don't have any limit to the fat volume so that we can volumize the face however they want. But people who are already having a small face and the like a bony face, they don't have the fat in the other areas also. Then what are the options? Other options are called fillers. Fillers made up of hyaluronic acid. The hyaluronic acid fillers will be given to the various facial areas so that we can make the face looks more chubbier. And more than chubbiness, we have to make the face not very bony. That is the idea of the facial filler injections where the sunken cheeks and bony face. So when you have a sunken cheeks, don't worry, you'll have the option even if you don't have the fat in the body. You have to understand this fact and approach your plastic surgeons. They'll definitely help you. Secondary nose deformities. Already I've done a rhinoplasty surgery, doctor, but it is okay, but still I'm not happy. Few areas are gone down, still it looks little crooked, and still my tip is not defined, still my tip is not elevated. For these kind of a things, filler is a very good option. We have a very strong fillers nowadays, and that fillers we inject, we can change a lot of things without going for the secondary surgeries. Because rhinoplasty second, third surgeries are extremely difficult, though we can do it, but sometimes results are not very much predictable. In that kind of a cases, doing a 10 minutes work in the office and finish that work and giving a very good appearance is much easier than going for the secondary surgeries. So if you already underwent a nose surgery, still you are not happy about the nose, still I don't want to go for the second surgery. If that is the case, ask your plastic surgeons. Filler is always the option. Everybody wants to have a chiseled jaw. The various reasons, sometimes your jaw won't look like a chiseled one. You have a jawline starts from here, suddenly disappears, then chin droops. So you're not happy about the jaw definition. And nowadays, the selfie culture, everybody wants to look good when they take a photograph. So, what are the reasons why your jawbone doesn't look chiseled? One main reason is you have a lot of fat in this region. So, if you have a lot of fat, your double chin liposuction will be definitely a good tool to give a contour to your jawbone. Second thing, sometimes your jaw angle is less prominent because your bone is not strong there. Sometimes injecting the filler in this region will give a very good definition to the jaw. And few times what happens is jaw is droopy. Another thing is this area where the chin ends and the jaw starts, this area, sometimes you have a loss of volume here. Because of this also, your jawline definition will disrupt it because it comes from here. Suddenly there is a disruption of the jawline here, then again the chin starts. So it won't look good. So giving the filler and we can make the whole jaw looks very defined. And sometimes along with the fillers, we use Botox to lift the lower face. Basically, it's called Nefertiti lift. We can do a Nefertiti lift using the Botox to lift the jawline definition. See, understand this concept clearly before you meet your plastic surgeon, and the plastic surgeon will examine you and guide you properly to get a chiseled jaw without going for any surgical procedures.